I'm Dr. Dan, and welcome to this week's Smilecast. This week we'll be talking about popcorn. Yeah, popcorn. I've had two different people this week break their teeth on popcorn, and you know who you are. But what I get asked often is, how did something so small as popcorn or toast or bacon or whatever it is break your tooth? You see, there's a certain life cycle to teeth. Oftentimes when you're 6, 7, 8 years old, you get a small cavity on the tooth and the dentist tells you you need a filling, and they put in a very small filling. Then, sometime in your late teens, early 20s, you get a cavity on the same tooth and the dentist tells you you need a filling, and then we put in an even bigger filling. Time goes by, say 30 years, and all of a sudden you're 50 years old and you're eating a piece of toast in the morning and you break a tooth. You're wondering, how does something so small, something that's been there for 30 years, break a tooth? What happens is, little fillings turn into big fillings, and fillings are inside of the tooth. And every time you bite down, small forces over long periods of time create stresses. And this separates the tooth, and all of a sudden it's the proverbial straw that broke the camel's back. A little piece of bacon breaks your tooth. The idea then is to restore it with a crown. And the difference between fillings and crowns is this. Fillings are inside the tooth, acting like a wedge, so every time you bite down, it stresses the tooth and splits the tooth apart. A crown goes over the tooth and is cemented on and holds the tooth together. Thus, when you break a tooth, oftentimes your dentist will tell you that you need a crown. And really, it was because of all of the fillings that you had when you were young, plus the time that you were fortunate enough to live, that caused the tooth to break. So if you've broken a tooth on popcorn or pretzels, give our office a call and we'll get you smiling again. Because at the Fornetti Dental Center, smiles are what it's all about.